Claravis is a medication that is used to treat severe cystic acne, also known as nodular acne, that has not responded to other treatments. This includes benzoyl peroxide or clindamycin applied to the skin, or tetracycline or minocycline taken by mouth. It belongs to a class of drugs known as retinoids and works by decreasing facial oil production. High amounts of oil can lead to severe acne, which if left untreated, may cause permanent scarring. It is important to take Claravis exactly as prescribed by your doctor. The daily dosage varies depending on your condition and medical history, and it is best to take it with food to help the medication be absorbed better. Remember to take it at the same time every day for the best results. Before you start taking Claravis, make sure to read the medication guide provided by your pharmacist and sign a patient information/informed consent form. Always consult your doctor or pharmacist if you have any questions about this medication. Take this medication by mouth as directed by your doctor, usually twice daily for 15 to 20 weeks. It's important to swallow the capsules whole and not crush or chew them. Some brands recommend taking this medication with meals, while others say it can be taken with or without food. Taking it with food helps increase absorption into your bloodstream. Make sure to drink a full glass of water, 8 ounces/240 milliliters, unless your doctor directs you otherwise, and avoid lying down for at least 10 minutes after taking this medication. The dosage of Claravis is based on your medical condition, weight, and response to treatment. Your acne may worsen during the first few days of taking this drug, and it may take up to 1 to 2 months before you notice the full benefit. If severe acne returns, a second course of treatment may be started after you have stopped taking the drug for 2 months. It's important not to take more than the recommended dose, as the manufacturer does not recommend long-term use of Claravis. It's crucial to note that this medication can be harmful to an unborn baby, so women who are pregnant or may become pregnant should not handle this medication or breathe the dust from the capsules. If you experience dry lips and mouth, minor swelling of the eyelids or lips, crusty skin, nosebleeds, upset stomach, or thinning of hair, it's important to let your doctor or pharmacist know. They can provide tips on how to relieve dry mouth, such as sucking on sugarless hard candy, chewing sugarless gum, drinking water, or using a saliva substitute. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. While many people do not experience serious side effects, it's important to tell your doctor if you notice any changes in your mental health, tingling sensations in the skin, back/joint/muscle pain, signs of infection, painful swallowing, or peeling skin on palms/soles. In rare cases, isotretinoin may cause pancreatitis, a potentially fatal condition. If you experience severe stomach pain or severe, unrelenting nausea/vomiting, stop taking the medication and contact your doctor immediately. Additionally, stop taking this medication and seek medical attention right away if you experience severe headache, vision changes, ringing in the ears, hearing loss, chest pain, yellowing of the eyes or skin, dark urine, severe diarrhea, or rectal bleeding. While a serious allergic reaction to this drug is rare, it's important to seek immediate medical help if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or difficulty breathing. It's important to note that this is not an exhaustive list of potential side effects. If you experience any other effects not listed here, be sure to contact your doctor or pharmacist for further guidance. If you are a woman who is pregnant or planning to become pregnant, it is important to avoid using Claravis, as it can cause serious and sometimes fatal birth defects, miscarriages, and premature births. Female patients must use 2 effective forms of birth control or completely avoid sexual intercourse for 1 month before starting Claravis, during use, and for 1 month after stopping the medication. It is also important to have monthly pregnancy avoidance counseling from your doctor. Do not use mini pills for birth control, as they may not work as well with Claravis. If you are late in having your period, or if you have sexual intercourse without using 2 effective forms of birth control, stop taking this medication and contact your doctor immediately. It is important to discuss the risks and benefits of using Claravis with your doctor, and to carefully follow the requirements of the iPledge REMS program in the United States. If you live in Canada or any other country, consult your doctor and pharmacist for your country's regulations. Before taking Claravis, it's important to let your doctor know if you have any allergies to isotretinoin, vitamin A-related drugs, or any other allergies. This medication may contain inactive ingredients that can cause allergic reactions, so talk to your pharmacist if you have any concerns. Also, make sure to inform your doctor about your medical history, especially if you have diabetes, high blood fats, mental/mood problems, liver disease, eating disorders, alcohol abuse, or bone loss conditions. While taking Claravis, it's important to avoid donating blood, limit your time in the sun, and use sunscreen to protect your skin. This medication can also affect your night vision, so avoid driving or using machinery at night until you are sure it is safe. If you wear contact lenses, you may experience some intolerance while using this medication. And avoid cosmetic procedures such as waxing or laser treatment during and for 6 months after therapy, as it may cause skin scarring. It's important to avoid alcohol while taking Claravis, as it may increase the risk of certain side effects. Playing contact or repetitive impact sports may also result in bone problems, so consult your doctor for more details. This drug must not be used during pregnancy, and women who are pregnant or may become pregnant should not handle this medication. You must have 2 negative pregnancy tests before starting this medication and have a monthly pregnancy test during treatment. It's also important to consult your doctor before breastfeeding while using Claravis. It's important to be aware of potential drug interactions with Claravis. Some products that may interact with this drug include tetracyclines, vitamin A-type drugs, vitamin A, and drugs that cause bone loss. It's important to inform your doctor of all the products you use, both prescription and non-prescription, as well as herbal products. This will help your doctor and pharmacist determine if there are any potential interactions with Claravis. Additionally, if you start any new drug, be sure to let your doctor know and discuss if you should use additional reliable birth control. Keep an eye out for any new spotting or breakthrough bleeding, as these may be signs that your birth control is not working effectively. If someone has taken too much Claravis and is experiencing serious symptoms like passing out or trouble breathing, it's important to call for emergency help right away. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center for assistance. Symptoms of an overdose may include vomiting, stomach pain, facial flushing, headache, and loss of balance. If you or someone you know is experiencing these symptoms after taking Claravis, seek medical attention immediately. Make sure that only the person prescribed this medication takes it, as it can cause birth defects and other serious health issues if taken by someone else. While you are taking Claravis, you may need to undergo lab and/or medical tests such as pregnancy tests, blood cholesterol/triglyceride level checks, liver function tests, white blood cell counts, and eye exams. It's important to keep all your medical and lab appointments and consult your doctor for more details. It is important to follow your doctor's instructions for taking Claravis, including the daily dosage and the optimal timing for taking it. If you happen to forget to take a dose of Claravis, just skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. Make sure to store Claravis at room temperature, away from light and moisture, but not in the bathroom. Keep it out of reach of children and pets. Do not flush it down the toilet or pour it into a drain unless instructed. When it is expired or no longer needed, make sure to properly discard it by consulting with your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.